Okay, so where are we going? What are we going to learn? Look at lateral hip and thigh muscles and their innervation. Caudal thigh muscles and their innervation. Medial thigh muscles and their innervation. Cranial thigh muscles and their innervation. So we're going to work our way around. We'll then look at the cranial muscles of the crus with their innervation and the caudal muscles. Then we'll look at the vascular supply to the pelvic limb. Lateral hip and thigh muscles need to consider the normal range of motion of the hip joint. Okay, it's got a lot of actions, remember. We need to think about which muscles act to rotate the hip, which are abductors versus adductors of the hip, extensors versus flexors. Where are they going to be located? Okay, some of these muscles also act on the stifle, extensors versus flexors down there. Okay? Then we need to know the appropriate location of the sciatic nerve. Okay, this image as well as this one to kind of help you look at the muscles, think about where it is in relation to the bone, and figure out those actions. Okay? So, that's about where the sciatic nerve is. Deep to, what muscle is that? Biceps femoris. Yeah. Generally, when we are giving intramuscular injections, we want to go more caudal. Okay? In the large animal, my favorite place was just the other side of this groove here. Was back in here in the semi-tendinosus, semi-membranosus. Okay? Because you don't want to get that sciatic nerve. Okay? The animal will not be happy with you. So go caudal and then you'll be fine. We're going to come back to the sciatic in a little bit. Okay, so up here in the caudal area of our hip, we've got a muscle sitting there. What muscle is that? It's the superficial gluteal muscle. Okay, notice I put on this bone image over here, I put where it's attaching. And what is that place called where it's attaching? It's going to be the third trochanter. Yeah. Okay, so superficial gluteal muscle is on the third trochanter. What is this muscle that we see most of here? That's going to be the middle gluteal muscle. Okay? So I showed where it's also attaching to the ilium. Its origin and its insertion is on that greater trochanter. Deep to that, we find another muscle. If we have a superficial, we must have a deep gluteal. Okay? Notice where it's attaching. Okay, so what's the common action of these muscles, of all of them? They're going to abduct. Okay, primarily the deep's doing that. If I kind of draw in the deep on both images there, the fibers are pulling that way and that way. So that's going to cause abduction. Okay? But in the dog, they also, especially the middle gluteal, is going to do what? Extend the hip. Okay? So if I draw that in there, we can see how that would cause extension because our point of rotation is here. So it would tend to pull it up like that. Okay? Now, superficial, we're going to see the same type of thing because it's coming over and it's attaching to that deep gluteal fascia, which is on the surface of the middle gluteal. Okay, so it's acting very similar. Okay, we also know because of the way the middle gluteal attaches on the ilium, if I were to draw it in right there, it's going to kind of pull that way, which is going to cause what? So we'll see this go like that. That'll be medial rotation. Okay? Remember, that's just an incidental because of its attachment. And so we need muscles that are going to laterally rotate the hip to counter that. Okay? So we have the superficial is the same as the gluteus maximus in the human. The middle, the gluteus medius, that's kind of easy to remember. And then the deep is the gluteus minimus. So if we do look at this illustration I drew, this is going to be the gluteus maximus muscle. And here's the gluteus medius. We're not going to see the gluteus minimus on this image. So gluteus maximus is the primary hip extender when climbing or when standing from a squatting position, like you're getting up out of a chair, that type of thing. Okay? So our hamstring muscles, the caudal thigh muscles, the hamstrings, are going to be the primary hip extenders during locomotion. Okay? So let's look at the nerves that innervate these things. Okay? Starting over here at the left, I reflected up the superficial gluteal muscle. And so this one that is deep to it must be the middle gluteal. Yeah. Okay. And between them, we find a nerve that's only going into the superficial gluteal muscle. And the superficial gluteal is the caudal-most of our gluteal muscles. So we're going to call this nerve the caudal gluteal nerve. The caudal gluteal nerve is going to innervate the most caudal of the gluteal muscles, the superficial gluteal. Okay? So on the image over on the right, we've got the middle gluteal reflected. Deep to that, we have the deep gluteal muscle. And you can see that cranial and ventral to that, we've got a triangular shaped muscle, which is the tensor fasciae lata muscle. Okay. So if the caudal gluteal does the caudal-most muscles, what are we going to call the one that does the more cranial muscles? Hey, there we go. So there's the cranial gluteal nerve. Notice it's right there. It's going to send branches into the middle gluteal. It's going to penetrate through the deep gluteal, innervate it while it goes by, and then it's going to go all the way over to the tensor fasciae lata and innervate that one as well. Okay? So our cranial gluteal is going to get all those guys that just wiggled at you. We're going to have a vessel running with that. Guess what we're going to call the vessel? Cranial gluteal artery. Okay, this is just for fun. This is the feline. And we've got, just like we do in the dog, a middle gluteal muscle, a superficial gluteal muscle. But then we have a muscle that we don't see in our other animals, caudal femoralis muscle. And that, of course, is the biceps femoris. Caudal femoralis muscle is really unique in that it consists of white muscle fibers, which are what type of fiber? They're fast twitch. So they should fatigue quickly. These are still fast twitch, but they don't fatigue. And so these are involved in the propulsion of the animal. And it's just a unique thing to the cat, that they're fast twitch, but they don't fatigue like fast twitch generally do. Cool stuff. Okay, let's move back to the caudal thigh muscles now. Who's this guy? This is the biceps femoris muscle. There's this one. You get in the habit of working your way around. That's going to be the semitendinosus. And then the next one is going to be the semimembranosus. I noticed in some dogs that semimembranosus doesn't separate into two heads very readily. There's just some variety among animals, okay? And so notice over here, I show you where these guys are attaching, and what is this structure right here on the ischium? The ischial tuberosity, yeah. So all of these guys are originating from the ischial tuberosity. Okay. These guys are going to primarily be hip extensors. So our biceps femoris muscle, what does it also do in addition to extend the hip? Flexes the stifle. Also remember, it extends the stifle. That's that one that plays funny. We can see these more caudal muscle fibers are coursing down here, more caudal to the crus, are going to cause flexion of the stifle, whereas those that are more cranial going into the deep femoral fascia are going to cause extension of the stifle. Okay. Also, because it has part of that common calcaneal tendon, it's going to extend the hock. Okay, semitendinosus muscle. It also is crossing caudal to the point of rotation of the stifle, so flexes the stifle as well as extends the hock. Okay, so those two have components in our common calcaneal tendon. Semimembranosus muscle may also, this portion here is going to do what? It's attaching distal and caudal to the point of rotation of the stifle, so it's going to flex the stifle, whereas when the limb's planted, if both of these muscles pull, it's going to extend the stifle. Okay? So flex or extend the stifle. Okay, so here's all these muscles that we just identified. And we've cut it open so that we can see this nerve running back here, and this nerve is? That's the sciatic nerve. So the sciatic nerve is going to innervate these guys. Biceps femoris, semimembranosus, semitendinosus. And they're primarily the extensors. So same deal as in the front limb. They're innervated by location, and they have similar action. We move on to the medial hip and thigh muscles. These are primarily adductors of the hip, or you could say they prevent abduction. It's kind of the same thing. I guess it's whether you're aggressive or passive. Okay, so this muscle here is the gracilis muscle. This one here is the adductor muscle. This little peck of a muscle here is the pectineus muscle. Okay. So gracilis also, as I told you, it's going to extend the hip, flex the stifle, and extend the hock. The adductor is also going to extend the hip. The important thing about these additional actions is to remember animals built for speed, their adductors and abductors are also going to have flexion and extension actions upon joints. So we can get more muscles doing the same action, so we get less resistance to overcome, so they work more efficiently. Okay, so here's the sartorius, the cranial head, and the caudal head. Let's get ourselves oriented here. There's the vastus medialis muscle. There's the pectineus. And there's the adductor muscle. Down here's the gracilis, cut and reflected. Okay, so we've got a nerve here that's running through here and then down through here. Okay, it's going through the obturator foramen. I'll leave you with that for a minute. So this nerve here is the obturator nerve. Okay, so obturator nerve is going to innervate pectineus, adductor, and gracilis muscles. Notice that obturator nerve, before it goes to the obturator foramen, it's going through the pelvic cavity. it's very susceptible to damage. When an animal is giving birth, particularly see this in cattle, they're giving birth to a young. If that calf is too large or it just starts through the canal the wrong way, it can damage this nerve. And then when that cow gets on a surface that it needs to maintain the limbs under them, it's going to slip out and be splay-legged. Okay? Not a good condition to be in. Okay, something else we're going to note here. We got this little triangle bound by basically the abdominal muscles, the pectineus muscle, and the caudal belly of the sartorius. And we find vessels in there. Hopefully you've seen that. That's known as the femoral triangle. And the opening in the abdominal wall those vessels come through is known as the vascular lacuna. Okay? Okay, let's look at these superficial cranial muscles of the thigh. This one is. So we have the cranial caudal bellies of the sartorius muscle. And then this one in purple is tensor fasciolata muscle. Okay? So these guys, their common primary action is going to be flexing the hip. We see that the cranial belly of the sartorius and the tensor fasciolata are also going to extend the stifle. Okay? The caudal sartorius then would, look where it's going. It's coming down here, caudal to the point of rotation. So it's going to flex the stifle. Okay, cranial thigh muscles. Here once again is cranial head of the sartorius. The one in purple, kind of adjacent to the more proximal part, is it's triangular shape. Our tensor fasciolata. And then we have our quadricep muscle. The more lateral belly is the vastus lateralis. Then we have the more medial belly, the vastus medialis. Right in between the two, the one that we've transected on the right image is the rectus femoris muscle. And then in between the two vastus, right up against the bone, is the vastus intermedius. Okay? So the vastus muscles, remember, all of them originate from the femur. Where do all of these muscles insert? On the tibial tuberosity. So the common action of these muscles is to, these are the primary extensors of the stifle. Rectus femoris is also going to flex the hip. Remember, it crosses and attaches where on the ilium? Tuberosity of the rectus femoris, yes. Okay, so up cranial and proximal, we see there's the sartorius muscle cut and reflected. We've cut the rectus femoris muscle here. We see our vastus lateralis, vastus intermedius, and our vastus medialis. And we see this nerve going into it. These muscles, the vastus ones, originate from, what did I say? The femur. So what's a good nerve to call go into these guys? This is going to be the femoral nerve. Okay, so the femoral nerve is going to innervate all of these guys, including the sartorius. Okay? Okay, muscles that flex the hip. Let's start out by identifying some of these that we're not going to worry about, such as the middle gluteal muscle, here transected. The deep gluteal muscle, just deep to it. The vastus lateralis muscle. And then on this more medial view, you've got the vastus medialis muscle, the gracilis muscle, the adductor muscle, and the pectineus. Okay, so what were the muscles that flex the hip? We have the sartorius muscle, The one in red is the cranial, the one in pink is the caudal belly. And notice here I'm putting their origin up on the ilium. Who else does that? Tensor fascia lata muscle. Erectus femoris muscle. And then we have the iliopsoas muscle. We've got, on this image, pectineus. And so just deep at its more proximal end, we see this muscle here, okay? So we have a portion of it coming from the ilium, as I show you on this image to the right, called the iliacus. And it is going to join the psoas major muscle. And they're going to attach to the lesser trochanter. And those together, because it's the iliacus and the psoas major, we call the iliopsoas muscle. And hopefully you can see how that's going to be a very strong flexor of the hip. So that's our primary flexor of the hip. Okay, we're looking at the caudal aspect of the thigh. This muscle here is, notice it's coming all the way down here, below the stifle. Lateral side, that's going to be the biceps femoris muscle. We move more medial and caudal to that. We have the semitendinosus. We move more medial. We have the semimembranosus, and then on the most medial surface of the thigh is the gracilis. That's what you want to do. You want to work your way around the specimen. Okay, so you can know where you start and work your way around. And then we've got this guy here behind the stifle. That must be popliteal lymph node. Yeah. Okay, let's move on down to the crus now. This most cranial one on the tibia is the cranial tibial muscle. Notice that its tendon of insertion wraps around the medial side of the pes to attach to the plantar surfaces of the metatarsal bones. We move more lateral and caudally. We have the long digital extensor muscle. Remember the common digital extensors in the front limb. This one is longer. It's the long digital extensor muscle. And then we have a kind of a triangular one here, whose tendon of insertion also wraps around to the plantar surface of the pes. The peroneus or fibularis longus muscle. Okay? Remember, the fibula is lateral. Okay? These guys primarily are going to be flexors of the tarsus, but also the cranial tibial does what? It's going to supinate. Remember, it goes around that medial aspect to attach to the metatarsals, and so that's going to cause a lateral rotation. So it supinates. Long digital extensor muscle also, it's in the name, extends the digits, and then the peroneus longus also does. It's coming around the lateral side to attach to the plantar aspect of the metatarsals, so it's going to pronate. Okay? So, when the animal's walking on uneven surface, it helps prevent them from over-rotating either way. Okay? But together they're going to do a great job of flexing the tarsus. There is a lateral digital extensor muscle. It's very small in the dog, so we're not going to worry about it. And just as in the front limb, only those with digit in the name have action on the digits. Okay, what is this connective tissue structure here? That's going to be the crural extensor retinaculum. And then just distal to that, we had the tarsal extensor retinaculum. Okay, let's look at the medial caudal muscles. This one right up against the caudal surface of the tibia is going to be the its tendon is going to go over the sustentaculum tali on its way down. Deep digital flexor muscle. Then we have this guy kind of hiding and then does this funky little twisty thing so that it comes out more superficially down here. That's going to be the superficial digital flexor. We have a deep, we have to have a superficial. And then this large guy here who has two bellies, that is the gastrocnemius. Okay, so these guys are going to have what common action? They're going to extend the tarsus, except for the gastrocnemius, they will also flex the digits. Just as I said, has to have digited name if it's going to act on the digits. Okay, hopefully, if you haven't, you will see this funky little twist going on here, where it's coming around like this, and this guy back here is coming around like this. Okay? Because we need to get that superficial digital flexor, which is originally deep to the gastrocnemius tendon. We need to get it more superficially so it can pass on down the limb, and the gastrocnemius tendon just attaches to the tuberocalcaneal. Okay, then we have the popliteus muscle. Okay, over here on the medial side, it's attaching right up to the tibia, and then it comes around. It originates on the lateral side in a fossa. What's that named fossa? Right there. Popliteal fossa. Okay. And so it's pulling this way. It's going to cause what action on the stifle? Because it crosses the caudal aspect of the stifle. Flexion of the stifle, but it's also going to do what to the limb? Because it's taking the medial portion caudally, which is the same as taking the cranial portion medially. So it's going to cause medial rotation of the limb. Okay, so here, pointing out the lateral collateral ligament of the stifle, and we see going deep to that tendon of origin of the popliteus muscle attaching to the popliteal fossa. There's actually a sesamoid in that popliteal tendon. Okay, so on a radiograph, don't think that's a broken fragment of bone. That is the popliteal sesamoid. Those are really hard to save, okay? So, most cranial muscle is the cranial tibial muscle. We move more caudalaterally. We've got one that goes all the way down to the digits. It is the long digital extensor muscle. Then the triangular one, adjacent to that is the peroneus longus muscle. Okay, moving around caudally. Right up caudal aspect of the bone is going to be deep digital flexor muscle. There's a lateral and a medial head of that. And then kind of tucked under the gastrocnemius, which is here, we find the superficial digital flexor muscle. Okay, we do not see the popliteus here. Right here, what was the nerve we found deep to the biceps femoris muscle? The sciatic nerve, okay? Here's the sciatic nerve. Now it's going to branch. One branch is going to go more cranial lateral. What bone is lateral? Fibula. What's another word for fibula? We've used it already today. Peroneal. What's going to be a good name for this nerve? Peroneal nerve. It's actually known as the common peroneal. And so that's who's going to innervate these guys. Okay? Then we have a more caudal branch. It's more caudal and medial. If we have a peroneal, why don't we call the other one the... How about the tibial nerve? So the tibial nerve is going to get those caudal medial muscles. Right there. So our common calcanean tendon consists of primarily gastrocnemius and superficial digital flexor. Who else is involved in that? Biceps femoris, semitendinosus, and gracilis. Now let's go on with vessels. Okay, so we're going to start out in the abdomen. We're going to see the external iliac comes off the aorta. It's going to be the primary vessel to the limbs. Just before it comes out of the abdomen, we're going to see it give off a deep branch, the deep femoral artery. And this is while it's still in the abdomen. After that deep femoral artery comes off, it continues as the femoral artery. Deep femoral artery is going to give off the pudendo-epigastric trunk, which consists of the caudal epigastric and the external pudendal arteries. Okay? After it gives that off, it changes names. You know how these arteries do that. And it's going to continue as the medial circumflex femoral artery. That's the artery that's going to be kind of deep to the pectineus and the adductor, right in there. Okay? So that's what it's supplying, those muscles there. Okay, now here we have the femoral artery coming out of the body cavity. And we're going to have a branch that runs basically just deep, so it's running laterally. The lateral circumflex femoral artery, okay, continuing on down and coming off right close to it is going to be the superficial circumflex iliac artery. So femoral artery then here, it's coming on down, it's going to start to dive deep into the muscle, and it's going to give off a proximal caudal femoral artery. The femoral artery is going to give off a very thin branch that's going to stay superficial, and it's going to stay superficial on down the medial aspect all the way down into the crus, and that's the saphenous artery. And it's going to have a cranial branch and a caudal branch. Now after it gives off that, it's going to start to dive deep. Okay, so we have a proximal and a middle caudal femoral artery. That middle caudal femoral comes off just after the saphenous artery when the femoral starts to dive deep. And then as we get down, let me label all these guys. We're going to get right behind the stifle, and we're going to give off a distal caudal femoral. That's where our distal one comes in. When that distal caudal femoral comes off, the main artery is going to continue as a different name. It's right behind the stifle. What do you think we should call it? Yeah, the popliteal artery. Now that popliteal artery, as you see in my little illustration, is going to course between the tibia and fibula. Just before it does that, it gives off a little tiny artery we're not going to worry about, which is called the caudal tibial artery. So guess what else we're going to have? A cranial tibial. So that cranial tibial is going to be important to us because that's the main supply going down to the limb at this point. And it's going to be deep to those craniolateral muscles right up against the tibia. When it gets down to the tarsus, as soon as it crosses that tibiotarsal joint, it's going to change its names because now it's dorsal to the pes. We're going to call it the dorsal pedal artery. Okay, and that's as far as we're going to trace the arteries down. Okay, what vein is this? This is the lateral saphenous vein. And it's also going to branch into a cranial and a caudal saphenous branch. Thanks for your attention.